tell you, as I hear more people working here with their feet on the ground in Arizona, I can't tell you how fortunate I feel to have been able to be part of this group this year and be able to know such dedicated, hardworking people. Our next speaker is Jason Odhner. He's a community health organizer and a registered nurse who is representing the Phoenix Urban Collective. The Phoenix, clap for it, be proud. The Phoenix Urban Collective is a deinstitutionalized network of medical professionals that is working at the intersection of community health and human rights. Mr. Odhner?
Thank you guys all for being here today. It's such an honor to see everybody here gathered. It's an honor to have the support and the solidarity of all of these doctors, nurses, midwives, EMTs. It's an honor to have support of people like Dr. Eric Myers, who's taking a stand with us today, Ruben Gallego, who made this possible by securing us the Capitol lawn here. I just want to say it's really hard living in Arizona right now as a medical professional. And it's hard because we really care about public health. We care about building healthy communities. We care about people having what they need to have healthy lives. And you know, a community can never be healthy when it's living in fear. There is no such thing as a healthy, oppressed community. So here we are gathered, hundreds of doctors, more walking up even as we speak. You know, we're gathered together, nurses, midwives, EMTs, because we are sick and tired of having the legislature, which should be working, should care about building a healthy community, should care about having a healthy state, and they continually undermine this and show grave disrespect for community health when they pass bills like SB 1070, when they try to pass bills like 1405, which would have turned every hospital in the state of Arizona into a Border Patrol checkpoint, essentially. When they keep on passing these bills, they need to understand, and we all need to understand, that we are dramatically undermining the health of our communities. We're making people afraid to seek emergency medical care. We're making people afraid to reach out for primary care in emergencies. We're making people afraid to go to shopping, to go to the store, to access services that they need in order to stay healthy. And when one segment of society is unhealthy, the entire society is less healthy. It's just that simple. You know, this isn't just some radical position that I'm taking. As you can see, this is a mainstream position. This is why we have hundreds of doctors here today. This is why the American Nurses Association has officially stated that undocumented people, like all people, have a right to access to basic health care. This is not a radical position. This is a position of the Arizona Public Health Association. This is a position of a large number, almost every public health related group that has weighed in has taken a stand against bills like SB 1405 and now recognizes that bills like 1070 is an assault on community health. And so if we're not the ones taking the radical positions, who is? We want you to know that the legislators who push bills like SB 1070, that is the extremist agenda, not us. That is the radical agenda. People like Russell Pierce, people like Joe Arpaio, they have the radical agenda. We are the mainstream. We are the nurses that you trust. We are the doctors that you trust. We are the ones who are here to make you healthy. We just want to make everyone healthy. We want to take care of people. And we're going to take care of people. And it's important that people understand that we will not comply with laws that ask us to be recruited, conscripted into some sort of de facto immigration enforcement army. We won't do it. Not because we're difficult, not because we're radical, because we took an oath. And that oath is more important and more sacred than any racist law that you can pass. That oath is the most sacred thing in our lives. And that oath demands that we protect the health of vulnerable communities. That oath demands that we stand up for people in need. And that oath demands that we treat all people equally, whether they're documented or not, whether they're mentally ill or not, whether they're rich or homeless. We want to take care of them, and we want to help them become healthy. And so that's what we're here to say today. We're just in it for their health. We just want to build healthy communities. And it's time for the legislature to stop placing barriers in front of us as we try to accomplish that goal. It's time for us all to work together and to take care of each other. Thank you for being here.